Hi, my name is Anu Shenoy Bhangle and I am the Program Director for the Abdominal Imaging and Interventional Radiology Fellowship at the Beth Israel Deaconess Medical Center in Boston. Beth Israel Deaconess Medical Center is a tertiary referral center located at Longwood Medical Area in the heart of Boston. Our Abdominal Imaging Fellowship is a Harvard Medical School affiliated, one-year ACGME accredited program consisting of 6 fellows. Our fellowship provides an in-depth abdominal imaging experience utilizing state-of-the-art imaging modalities. We pride ourselves on an excellent quality of cross-sectional interventional training, high volume and variety of body MRI cases, and the very visible collegiality of staff who always strive to create a fun learning environment for our trainees. Our reading rooms are spread across 2 campuses. I'd like to take you on a brief tour of the work areas and introduce you to some of our section staff members that are working on campus today. This is the ballroom or the main CT reading room on the West Campus in the Rosenberg building, where diagnostic CT, fluoroscopy, and CT procedure stations are located. The diagnostic CT rotation is a high-volume service shared with residents. The fellow reads a wide range of oncology CTs, a variety of vascular CT angiograms except neuro, CT colonography, CT enterography, CT studies with protocols catered to specific indications such as multiphase CT, CTA pancreas, besides others. We have more than 50 CT protocols to choose from, depending on the clinical indication. Fellows may be consulted by residents for CT protocol guidance. Fellows also participate in interesting CT case rounds and are the first-line consultants for walk-in clinical teams seeking clarification on CT reads. This is the interventional CT suite. Meet Dr. Olga Brook.
Hi, my name is Dr. Olga Brook. I'm a Section Chief of Abdominal Radiology and Director of CT. I would like to introduce you to the section and specifically to cross-sectional interventional service at BIDMC. Abdominal section performs large number of outpatient and inpatient procedures ranging from paracentesis, thoracentesis to complicated biopsies and drainages under CT and ultrasound. We perform solid organ and tumor biopsies in the abdomen such as liver, kidney, spleen, as well as lung, spine, lymph nodes, retroperitoneal and mesenteric and omental biopsies. With ultrasound, we perform from FNA of the thyroid and parathyroid to liver, renal biopsies. We guide surgeons in the OR for tumor resection, and we also place superficial abscess drains and perform percutaneous cholecystostomies. We are a large liver, kidney, and pancreas transplant center, and we also have a large pancreatic surgery center, which provides us this large oncology population, and thus we have both variety and volume of interesting procedures. We have large ablation program in which our abdominal fellows can participate. We practice holistic approach to procedures. We start from evaluating procedure request, evaluating patient prior to the procedure, including the actual procedure and technical specifics of the procedure, and then the follow-up. The follow-up includes both rounding and managing in patients with abscess drains and percutaneous cholecystostomies, and also performing rad path correlation to all biopsies to confirm both appropriateness of sampling and whether additional procedures or follow-up needs to be performed. If you come to BIDMC, you will become proficient and comfortable in the variety of high level of body interventions. Even more importantly, though, we take pride in our collegial atmosphere in the reading room and in the procedure suite. You will not just learn a lot, but you also will enjoy your time at BIDMC. Hope to see you here.
On the same floor is the ultrasound reading room with 3 ultrasound procedure areas dedicated to ultrasound-guided cross-sectional intervention. Meet Dr. Robert Kane, Professor of Radiology and our ultrasound guru.
So my name is Robert Kane. I'm one of the abdominal imagers, and ultrasound has been my passion for the last 45 years or so. One of the unique things about our fellowship is the amount and variety of interventional procedures we do with ultrasound. Basically, we do everything that you can do with ultrasound, from kidney mass biopsies and targeted livers to thyroids, salivary glands, parotids, you name it. And the reason we do that is it's a faster, more efficient way and doesn't take the CT scanner offline for an hour or more. So it's a little bit unique. Not too many ultrasound sections push the interventional envelope as much as we do. So I thought I'd emphasize that as part of the unique part of our fellowship. Of course, we do everything diagnostically, lots of Doppler with our transplant programs, small parts, and imaging for tumors and all that stuff. So it's a pretty broad spectrum, and I think most of our fellows have really appreciated their time here and enjoyed themselves as well. We enjoy them and all work together as pretty much as a team. So look forward to seeing you here sometime.
Moving on to the other campus, across the street, with reading rooms located in the Shapiro building and the RAB buildings. The body MRI reading room is located on Shapiro 4, next to the musculoskeletal reading room and the female pelvic imaging reading room. This is, as they say in the play Hamilton, the room where it happens. The body MRI reading room is always vibrant with the exchange of knowledge, ideas, and interesting cases. Meet Dr. Leo Tsai, the director of body MRI.
Hi, I'm Leo Tsai. I'm the clinical director of MR. I want to welcome you to sort of this presentation, and I want to talk a little bit about the body MR rotation. It's about 9 weeks, and it'll be spent in our Shapiro 4 building. We're unique in that we have a dedicated body MRI rotation for both our residents as well as our fellows. We do about 10,000 body MR examinations a year. So it's a very high volume service. We do a lot of liver and pancreas imaging. We're also the only New England center that does MR guided prostate biopsies. So there's the opportunity to do that as well. There's a lot of teaching that goes on in the body MR section. We have weekly follow-up conferences on Wednesdays and QA conferences as well. And an integral part of your training will also be the MR physics lectures, which are provided by members of the Division of MR Research here at BIDMC. So I welcome sort of you to take a look at Dr. Karen Lee's presentation regarding the body MR fellowship as well. I'll give you a little bit more insight into our section, which is run primarily by those 2 body MR fellows. But there's plenty of opportunity for the body fellows as well to do sort of concentrated electives in MRI and get to know our protocols and our scanning parameters a little bit more.
Lastly, I want to bring you to the other body reading room on East Campus. This reading room is unique due to the combination of diagnostic and interventional experience on this rotation. Meet Dr. Furi Bezui-Denut, the attending radiologist on this service today, and let's see what he has to say about this rotation.
Good afternoon, everyone. Welcome. My name is Furi Bezui-Denut. I am one of the abdominal attendings. I've been here at Beth Israel Deaconess Medical Center for almost 4 years now, and I've loved every second. Today you're with us in the CT East section, which is actually, it's a multimodality section where we incorporate ultrasound, fluoroscopic images, as well as CT and MRI, all in patient care, and providing our referring physicians with the best opinions that we can. We work closely with residents and fellows, and it's a team approach where no one is allowed not to say something, and no one's too senior to be in command without listening to the others. It's fun. The day flies by because of all the different modalities. You'll be exposed to ample procedures with ultrasound guidance as well as CT guidance. And I think, after a year that you've partially rotated here in East, you'll be an expert in the implementations of diagnostics and procedures in radiological patient care.
This concludes the mini tour of our section. For more information on the fellowship, research, and details of the variety and volumes of work that we do, I urge you to visit our website as well as check out the Body MRI website.